Laura's in there twice. I don't know why.
Good morning. Can you hear me okay?
Yes.
All right.
Okay. We have people still coming in.
Excellent.
So let's give it one more minute, see who else comes in.
All right. I'm going to test my speakers here one more time. As long as you can hear me okay.
I can hear you.
Okay.
Hear you as well.
Yes. Um,
And then Katie is the one of the developers behind the Claims Denial Navigator, so I have her on as well.
okay. Hi, Katie.
Good morning, everyone.
Hi, good morning, Katie.
There's still a couple more people signing in, but in the interest of time, let's go ahead and get started. Um, Good morning, everybody. Can you hear us okay? Give us a thumbs up. I'm going to take that as a yes. I can't see people's faces or anything. Um, so we're going to be covering the Microsoft Rural Health Resiliency Program and the Claims Denial Navigator. And I want to introduce you all to Laura Kriofsky from she's the National Director of the Rural Health Resiliency Program. And Laura thrives on driving digital transformation for social impact. And in her extensive healthcare career, she has worked in both tech and operations, served the public and private sectors, and has led consulting firms. And today, Laura leads the Microsoft Elevates Rural Health Resiliency Program, which brings AI innovation and cybersecurity services and solutions to rural and community health. And she serves on several health IT advisory board, is a member of Delta Omega and Public Health Honor Society, and is well-known advocate and thought leader. And if anybody was at our Western Flex last year, we got to hear um, a great presentation that she did at our Western Flex conference. So thank you for joining us, Laura. And Katie is behind the scenes as well. And I'll let you take it from there.
Awesome. Thank you so much, Jill. And Happy New Year, everybody. It's great to be here. Uh, I do have a long background in healthcare and healthcare IT, and I like to describe myself as a combination of healthcare IT nerd and healthcare policy wonk. So that's my short version of my bio. And I'm also from Tucson, so it's great to be here with the Arizona group.
I didn't know that.
Yeah. So, as Jill mentioned, I lead the Microsoft Rural Health Resiliency Program, and I'm going to talk just a little bit about that. And then we're going to dive right in to talk about the Claims Denial Navigator tool. But for those of you who aren't familiar with the program that Microsoft launched a couple years ago, this will be just sort of an overview of it, and we can make sure you have access to the website if you don't haven't already taken advantage of it. Essentially, the program started almost 2 years ago now with the request of the American Hospital Association, the administration at that time, and the NRHA. And they reached out and said, we are very, very worried about healthcare cybersecurity, particularly rural healthcare organizations and smaller healthcare organizations. Microsoft, we know that your Microsoft Philanthropies group, Microsoft Elevate now, does a lot of work and has a lot of special programs and offers to help under-resourced organizations. Can you help us? And Microsoft rose to rose to the occasion and said we'd be happy to help. And they launched this program really June of 2024. And the scope was really at that time, let's start with cybersecurity. And help firm the foundation, but also build towards the future and think about AI and innovation, and how we can support rural healthcare, rural hospitals on a journey. So the program started out with pro bono cybersecurity assessments, training, certifications, and all of that is continuing, and that's for all rural hospitals across the country. For independent CAS, REHs, and independent rural community hospitals in the extended CMS pilot program, that cohort of hospitals is eligible for Microsoft nonprofit pricing. And I'm super excited that almost every rural hospital that's qualified for the nonprofit pricing in Arizona has taken advantage of that. It's tremendous savings, somewhere of 60 to 75%, which can translate to 35, 50, even 100K per organization. And then all the other hospitals, all hospitals, rural hospitals are eligible for a 1 year of extended service update to Windows 10 devices and Windows 10 operating systems, which can really help from a cyber perspective, as well as from a giving you a little bit more life out of your existing technology. So that's the foundation. And now we talk to moving forward, and this is really where we've taken the program in 2025 and now into 2026. And this was, let's help rural healthcare, smaller organizations, under-resourced FQHCs, et cetera, prepare for the emergence of AI in healthcare and healthcare delivery. So I'll talk a little bit more. We've got a new tool, a cloud and AI readiness assessment that we're working with rural hospitals on. We are soon to be launching an entire AI skilling webinar series specifically for rural health, done in conjunction with a rural healthcare organization. We've got a cyber and AI webinar series. But today, what I really want to spend a little time on is the claims denial navigator and how that all came into fruition and what it is. So when we launched this program a year and a half, or actually 2 years ago, wow, time flies. We, again, thinking about the future, we knew that AI was going to be an essential consideration for healthcare and for rural hospitals and healthcare organizations. So we sat down and we created, in partnership with a number of health IT leaders and healthcare leaders from different sized hospitals across the country, a work group called RHAIL, Rural Health AI Lab. And we've had 2 of these work groups to date. And when we sat down with that group back in May, we said, hey, what could we use AI to help you with? And across the board, the first thing that this group of hospital leaders and IT leaders from all over the country said, help us with our revenue cycle. If we could use AI in one meaningful way, it would be in our rev cycle. And we said, okay, let's get into that a little bit more and come up with a very specific problem to solve, a use case. And so that's what we did in the first RHAIL, and we're going to dive into that here. And then the second RHAIL workshop is actually ongoing, but it was the same concept. We pulled together a group of rural health leaders from across the country and said, let's figure out a pain point for rural healthcare and how we could use AI to tackle it. That tool is not yet available, but we are actually sort of finalizing it next month. That tool will focus on outbound referral management. So you think of all of the variables and all of the information that has to be assimilated to come up with the right place, right time, right insurance, right provider, outbound referral. That tool will help staff address that challenge in that process. But for now, let's talk specifically about the Claims Denial Navigator. And before I jump there, this is just a slide that talks about the Rural Health Resiliency Program. You will get those slides after the session from Jill and her team, so you can review that data a little bit more. But it's suffice to say that we're working across the country with this program and super excited. And as I mentioned, super excited to be helping the rural health providers of Arizona. So before Katie and I jump in and talk about the claims denial navigator, I thought this was really interesting data from class research, which I refer to as kind of the consumer reports of healthcare and healthcare IT. They really have a pulse on health IT technology and trends and solutions, where they're at today and where they're going. And just a couple of weeks ago, actually, they published this study on healthcare AI and where organizations have focused their energies to date and where they're planning to use it. And I think one of the things that's really striking about this is that more and more organizations are really seeing the value of using AI tools to help with the rev cycle and the claims management. You can also see it's being used or will be planned to be used in a number of other areas. But this is some very timely data from class. All right, so let's talk about the claims denial navigator. As I mentioned, this was sort of our first product coming out of RHAIL, the AI Innovation Lab, and we had some requirements. First, it had to be low or no code, being very simple. Second, it couldn't we had to be able to give it away for free, which we're doing here on GitHub. Third is that everything would sit in your own organization's IT environment. So any of the data that you use this claims denial navigator for is your data. It stays in your environment, and you're not sharing it with Microsoft, and it's not going out into the ether. And then the other requirement was, let's make this available to all types of healthcare organizations and all types of EHR and billing systems. So it really sits side by side. I'm going to do a quick demo of it here on the next slide, knock on wood. But what it does is it takes in the publicly available Medicare and Medicaid payment guidebooks. It takes in the denied claim documentation that comes off the 837, and it 835, excuse me. And it takes in any sort of organizational documentation, notes, policies, ingests all of that. And then, as you'll see here in a second, what it does is it simply surfaces recommendations that the person working the claim can use to very quickly come up with a course of resolution for that claim. I think it's important to note it doesn't take any action. It leaves the final decision making up to the billing and claims professional. All right, so let's see if we can get this 2-minute video to work. Oh, go back this way. And if I can't get it to work, it is in the PowerPoint. It's always a mystery if it's going to.
This is the quickest way to go from AI beginner to...
I had it working in Teams this morning, so I apologize, Jill. We might have to take a...
Laura, I have the demo up on my screen.
Oh yeah, do you, Katie? Can you can I hand it over to you to do a quick share of the video?
I have in our sandbox, our slalom sandbox, I have the app open so I can go through it really quickly.
Oh, better than a recording. We get the real-time Katie.
Yep.
Please. So
Laura,
as Katie pulls it up, Katie is one of the developers that actually did all of the programming for the product for us on behalf of Microsoft. So she's an excellent resource. So Katie, you want to walk it through kind of high level how it works?
Yeah.
And I will say we'll leave a couple minutes of questions after this.
Yeah, so sorry for the blank here. My SharePoint site got deleted, but when you have it all together after you've downloaded it from GitHub and you've connected everything, you have your SharePoint upload site here where you upload your 835 files. Once those files are uploaded, there's background processes that parse the information from the 835, then send that information to your Azure OpenAI model to generate those recommendations. So as you can see here on the right, I have a bunch of 835 claims that I've run through. So I'm going to click this one. So as you can see, it got me the claim ID, the claim date, who the payer was. So in this case, it's Nevada Medicaid. So I had uploaded in the Azure portal, as Laura was saying earlier, you can upload your own documents. I uploaded some Nevada Medicaid documentation, and then some just general Medicare documentation. Got me the patient name, total, and then these were the claim adjustment codes that it found. It also tells you the service line that it is tied to, the amount, and if there is any RARC codes also found. So if I click one of these, it'll tell me the code again, the definition of the code, and then here is the recommendation that it gave me. So it noticed that the RARC code was associated with this claim adjustment code, and it gives me some recommendations and steps. And like I was saying earlier, right, this one was for Nevada Medicaid specifically for the payer. It tells me where to go in the Nevada Medicaid web portal because I uploaded some of that Nevada Medicaid information for how I can resubmit those attachments to get the claim going. And then before this, you can add your own information, right, as we talked about earlier. You can add user feedback down here as well. So I had run a claim with CO250 before, and I had added, like, we have to contact Franken Imaging to get the correct images or PDFs, or we have to go to or call someone else. So you can add this, add information in the feedback to make it extremely custom for your own hospital, right? If there's one person that you always have to go to get the correct files or get something adjusted, right? You can add that in here. It'll send it back to the Azure AI model. And then every time you see something with this claim adjustment code, it'll bring that back. So it can be super customizable to your specific hospital. So that is how the claims denial navigator works. Any questions?
Is this through the GitHub?
Yep.
And
so the GitHub is all of the so the Power Apps solution, and then there's also a bicep file to spin up those Azure resources. So once you download those items from the GitHub, and there's some instructions there on how to get it all started, then you get this all sorted.
Yeah, so I'll jump to that, how you get there, and then we can talk through that in a second. Katie, thank you. I think a couple of key points there is it does, ingest the feedback and the inputs from the user to make each sort of iteration a little smarter, a little faster. And then it's how it works like in the workflow of the staff is that they have the patient's record up, they're working the claim, and it's kind of a side-by-side experience. You could interface it to Epic or Meditech or CPSI or whatever, but at this point it's just a side-by-side tool. So all of the work is actually done in the billing system. And then you just sort of check off that I've done it over here and in the Claims Denial Navigator, and you continue within your existing workflow. But it's good, for working denied claims. It's also been a really well adopted for training of new staff, right? So that helps them get up to speed more quickly. So we're excited about that. And then I'm looking at a note. Is there potential to connect this to consumer appeals?
So I'm going to say I'm not familiar with consumer appeals. I'm not as well versed in the healthcare space, but if there is a template or a template to it, you can reuse the logic that we have for the 835 files for other files. So if you wanted to add different files, you'd have to work a bit on the back end, right? So you'd use what we have as a base and kind of just build on that to customize it to how you want it. But yeah, there would have to be a repeatable pattern, right, within the consumer appeals, which I assume there probably is for templates. So you could parse everything out correctly and then run it through your Azure OpenAI model, and then adding those specific documents that you need. I just wanted to make a note. This question has come up a lot of like, if our documents are updated, does that automatically update? No, you will have to download the new documents and then upload them into your storage account on Azure and run through the process to put it into the Azure OpenAI model. So that is the one drawback of keeping it contained, right? You will have to keep updates up with the documentation. But with that, you're way more secure because you're only looking at, the 5 to 10 documents that you put into the Azure portal.
Documents being things like the Medicare or Medicaid guidebooks and
Yeah.
your own
It could be
personal.
even Word documents. If you have like an Excel spreadsheet, that Betty in medical billing has had for 10, 15 years that she relies on, right? You can throw that in there. PDFs, PDFs, docs, Excels are the most common, but there's a few other extensions that you can put in there as well.
And Katie, to the question around using it from the consumer appeals standpoint, one of the nice things about the tool is we were basically giving you the configured source code that you can take and do with it as you want. So once you've taken it down from GitHub, you can modify and enhance it and do what you want for free with this tool in your own environment. So on this slide, we have the info sheet, which I've kind of got here, that talks a little bit more about it. This middle link where it says download the CDN tool is where you go on GitHub to download the tool and all of the documentation and all of the videos and tutorials. Katie has done just an exceptional job of putting it all out there on GitHub for free. And we've had close to I want to say like 250 hospitals or healthcare organizations download this already. So again, this is, really grateful for Katie's expertise and that of the team. One other thing we get questions on is like, how much does this cost? Well, the tool is free, and the three really things you need, SharePoint, you need Power Apps licenses, and you need a small, here's my technical term, bucket of Azure credit or Azure consumption to do the processing. If you are a nonprofit eligible organization inside of Microsoft, the Power App licenses, and don't quote me, but I think they're $15 to $20 a month per user. They come down to about $5 per user per month. And so that becomes very affordable, and you only need one or two, depending on how many billing staff you have. And then the Azure consumption for a small hospital, let's say a critical access hospital, again, depending on how much claim volume you have and how sort of robust you build this out, it's taken about somewhere around $150 a month of processing consumption on Azure to run this tool. As a nonprofit eligible organization, you get $2,000 of free credit, Azure credit every year. So it becomes essentially very much a low or almost no cost endeavor to explore this and begin to use it. And as again, one of the things I like about it, are a couple of things, it sits inside your own environment. And I think really importantly, it's your first, could be your very first sort of playground environment to start working with AI in your own organization. So super excited about the opportunity to share this more broadly with rural health and providers and orgs in Arizona. Before we lose Katie, are there any technical questions?
I have a question. What are the Power Apps? Is that Power BI or is it? This is a language I don't speak.
No, good question.
Yeah. So the Power Platform includes, right, Power BI, Power Automate, and Power Apps. So that interface that I showed you where the claim denial navigator is, that is a Power App, and more specifically a model-driven Power App. So it's based off of tables that we have in the back end, right? And it comes up with all of that interface really by itself. I didn't have to design any of that, right? It comes up with that itself. So it's very low maintenance that way. Um, for that specifically, you can also do your own like Canvas apps if you want to get really crazy with it. But this is just a model-driven app where it's very low maintenance, where we're just coming up with the tables and Microsoft is surfacing all of that with its own interface. So you're interacting with the Power app, and then in the background to do all of the parsing and everything else, Power Automate flows are run. So these are just like automations, and those you can do automations for really anything, right? If you get into the rural health program and kind of play around with that, get the credits, play around with the back end, you could do lots of things with Power Automate. You're not limited to, right, the claims denial navigator. You could do stuff with like emails, Teams, etc. It's kind of really the sky's the limit, especially within the Microsoft ecosystem of what you can automate.
Is
Yeah.
it pretty intuitive, or do you have to have your IT folks to set it up for you?
Um, for the claims denial navigator, you definitely want your IT folks to start doing that. But when you assign licenses, users usually get their own kind of like default environment, and that's where you can do like those email Power Automate things, right? Like maybe you want, if there's an attachment in email, to always download it to your OneDrive, right? You can create an automation for that. You can do your own personal automations for that. And that is pretty intuitive. They even have templates for it. Like I said, the sky's really the limit with Power Automate and what you can do and what you can automate. So if you have a lot of manual processes like in Excel, etc., you could probably do most of it automated via Power Automate and maybe with some Power Apps as well as kind of the interface.
So, a couple of quick things. So, Jill, I'm not deeply technical, as certainly not as much as Katie is, but I think of the Power App as the presentation layer, the way you get to the data and the way it presents it on your screen. And then, as Katie was saying, once you have that license, you can do more things in other applications and sort of co-create or create new workflows. And in terms of installing and implementing the claims denial navigator, Katie has worked with probably 10, 12 organizations. And your experience, Katie, is it takes about an hour and a half to get it installed and pointed in the
Yep.
right direction?
Yep. So usually the biggest hurdle is people not setting up the SharePoint site, and it takes a little while to propagate there. But once you have that SharePoint site going, it takes about 10 minutes to get all of the resources spinned up with the bicep file and scripting that we have on the GitHub, and then it's just a matter of uploading that solution to your new Power Apps environment, and that takes about 20 minutes, and then just kind of placing everything there, running a test. It takes about an hour.
Excellent.
So you
So
do offer support then?
technically, once we get it out to GitHub, it's yours to work with. But if you get really stuck and have a question, Jill, someone can email me and I'll work with Katie to get it resolved in the background. But just as a professional courtesy. But the general model is when it's like any other freeware you pick up once it's out on GitHub, it's kind of yours to care. The care and feeding is yours, but we want to make sure the hospitals are successful in using this. So we're happy to do a little troubleshooting and answer questions here or there.
And the YouTube playlist has, I have a full kind of walkthrough of how you install as well. So
Awesome. Thank you, Katie, for jumping on and obviously for all the work you've done to make this come to fruition. It's really exciting. Katie's going to, I think you're more than welcome to stay if you want, but I'm going to move on and just talk about a couple of other things, Jill, sort of in the context of where we're going from a rural health IT perspective. So I'm going to talk now about the Rural Health Transformation Program, a little bit about Arizona's plans, and then bring it back and close up with Microsoft's support of some of these initiatives, so you can kind of go full circle. But for those that are not familiar, the Rural Health Transformation, or we call it RHG because everything needs an acronym in healthcare, was part of the budget that came out in, I think it was signed on 4th of July. And it is a very significant investment across rural healthcare for the next 5 years. Arizona was awarded at 167 million at the tail end of 2020, at the tail end of 2025 for its investment in rural healthcare and technology and workforce, which we'll talk about here in a second, this year. So again, really, the goals of this is around innovation, workforce, technologies. We'll talk a little bit about that here in a second. But I had a chance to review the application put together by Arizona, and it really outlined, I think, very clearly its priorities for the program over the 5 years. And as we talked about, really workforce, growing the workforce, getting more professionals, both clinical and administrative, into working in rural healthcare organizations. And also, I think this is really important, upskilling the professionals already in the field. And whether it be clinical or technical, administrative skills to help them, continue their careers. The second was around priority health areas and healthcare management, the priority health initiatives, and a series of grants around public health and, around population health and other high area needs. Then we're making sure that it's accessible, right? How do you get the care you need in the way you as patients and consumers want it? And then healthcare resiliency. How do we make it sustainable, affordable for all? And so I looked at this model and I thought, well, let's talk about all the things Microsoft is doing and how it overlays. So I actually just literally did that. I sat and I thought about the programs and offers and services Microsoft has and where they support these different initiative areas. We've talked about some of it already, right? With the claims denial navigator supporting what they call the resiliency down at the bottom in terms of efficiency and getting money through the pipes faster. We've talked about cyber. We've talked about AI and skilling. We're going to be doing more and more of that to support rural healthcare. Also, Dragon Copilot, the clinical ambient listening tool, the whole field of clinical ambient listening and using those AI tools in the exam rooms has really taken off across healthcare, and what it can do in terms of workforce satisfaction and workforce retention is really remarkable. I was talking to an executive at a hospital here outside of Tucson recently, and he literally said that one of his ED docs came in, and after they had implemented a clinical ambient tool like Dragon Copilot, I think it might have been Dragon Copilot, but that ED doc came up and said, "Thank you. This tool kept me from retiring." And I think that's really important, right? Because the people that are delivering the care are so essential. So excited to do more and to support rural hospital adoption of that. And then the final thing I'm going to mention is down in that italics, and it's talking about Starlink, and I'm talking about that satellite in just one second. So in case that caught your eye. But this is ways to think about, all of the good work that Arizona is doing to support rural health and how the tools and services I mentioned earlier, the discounts, the free services can support each organization in that journey. Interestingly enough, I took a look at the CMS's program, and there was about 36, 37 applications, maybe a few more available at the time I did this analysis. And I ran them through Copilot research and said, tell me the number of states that had in their application noted the intent to focus in these different priority areas. So as you can see, workforce development was really the number one issue. And then tied were AI and innovation and telehealth, right? And that really gets back to access to workforce problems. But here's where I had sort of the uh-oh moment. which was around cybersecurity and IT modernization. It was kind of at the bottom of the totem pole in terms of interest. And I get that, right? This is sort of the foundational underpinnings that it's not all that exciting, but it is so essential. And so, I'm just going to spend 2 minutes talking about how, what this means for rural healthcare and some ways that you can help I call it firming the foundation with your IT and with your cybersecurity to enable AI and innovation, to enable kind of the workforce growth and development and retention. So IT modernization, what is it besides it sounds kind of wonky? Really at the heart of this, it is making sure you're taking steps to modernize and your technology to make it cloud enabled or cloud ready, to reduce risk, reduce manual workaround, reduce like firefighting. I saw a data point that the average frontline staff spends between 2 and 4 hours a week in rural and under-resourced hospitals, basically shaking their computers, getting it to work, right? So the old Etch a Sketch. But think of that, 2 to 4 hours a week dealing with reboots, with frozen screens, with outages, etc. That is just a tremendous loss. It's frustrating for the staff. It can take away from patient care. It's costly, right? So IT modernization is about healthcare organizations having a roadmap and taking structured and sort of pragmatic steps to modernize their technology to support things like AI and innovation and new tools for caregivers. We believe so much in this that we've actually been working with the American Hospital Association and the NRHA, and we've created a kind of a jump start tool to help hospitals do that assessment of where they are and then to get on that, I call it the modernization journey. So if you're an AHA member, you may have received this email, you may have seen our marketing on this, but essentially we've got a Microsoft funded pro bono AI and cloud readiness assessment tool that we're doing, just like we did the almost 500 cyber risk assessments in the last 18 months. We're really now shifting our energies to think about how do we help rural providers get cloud and AI ready. So we've got an assessment that our partners, FSI, do for on behalf of Microsoft. So it's not a Microsoft sales thing. This is really a holistic assessment. We fund it for FSI to do. They've done most of the cloud readiness assessments in a lot of the rural hospitals, so they're pretty familiar, with the cyber assessments. But essentially, this assessment looks at 6 domains. It looks at your technology, of course, your infrastructure. It looks at your security. It looks at your data, the quality of your data, how it's managed, because at the end of the day, you've got to have secure, high integrity, high fidelity data to inform analytics. It also thinks at things more like on the soft side of the house, which is, do you have an AI and a cloud strategy? Is your leadership at the organization have a guiding principles and a policy around cloud and AI use? It helps look at, what tools are you using, or do you want to use those use case? What's the use case for AI in your environment? And do you have the digital skills, your staff? Does your staff have those skills they need to really take advantage of tools and emerging technologies? So the survey takes about an hour, hour and a half. At the end, you get a free executive summary. And then I think what's really terrific is you get kind of that snapshot of where you're at, and then a set of prioritized recommendations to help the organization move forward. Now, this is not the end all be all, but it can certainly help any organization, I think, understand where they are in their maturity and in their journey. So if you haven't taken advantage of it, you can do so right on the Microsoft Rural Health Resiliency website. Just sign up. finally, we get to kind of where this all started, the cybersecurity, right? Um, Interestingly, cybersecurity is actually the number of cyber attacks in healthcare has declined in the last year, in 2 years, right? So 2 years, 2+ years ago, we had the very large Change Healthcare cyber attack, which just decimated and impacted so much of healthcare. But over the last 18 months, we've seen a shift. The number of attacks has actually gone down, which is terrific. And we're seeing some other shifts too. So in 2023, 2024, a lot of the cyber attacks were phishing, right? The innocuous click here emails that we all get with our name spelled incorrectly or something that just triggers that this isn't right. But what we're starting to see is those cyber criminals getting smarter, and they're looking for known vulnerabilities or vulnerabilities inside of your organization that they can get to. So it's not just going to you, the frontline users. They're actually infiltrating your systems with little bugs and having those bugs sit inside your environment, waiting for the right opportunity to infiltrate and to attack a system or a set of data. And so what it's doing is that's that concept of exploited vulnerabilities, going into the systems and looking for opportunities that already vulnerabilities that already exist. Also, really interestingly enough, is that we used to worry a lot about ransom for encrypted data. So bad guys would get in and they would effectively lock your data so that you had to pay that ransom. They're getting smarter, and what they're doing now is they're not always encrypting the data, but they're really, you can see the term here is extortion style attacks. And that's that little box in the lower right-hand corner. That has increased really 3 times over, 300-fold in the last couple of years, where they're not locking your data out, but they're still extorting the hospital, saying, we're going to put this on the black web. Or unfortunately, they're going to the patient level and saying, hey, we have your behavioral health data. And if you don't pay us this ransom, we will put it on the dark web. We will put it out there for other bad guys, bad girls, bad people to get a hold of. So I say this with a note of caution, right? Is that while the overall number of attacks has decreased, there's still an unparalleled amount of cyber criminal activity going on, and it's still really healthcare remains the number one target because of the value of healthcare data. I was doing some reading just recently, and the average value of a credit card number on the internet is in the dark web is a few dollars because banks and financial institutions have gotten so good about the minute that they detect a fraud, intercepting it, right? It doesn't work that well in healthcare. Once your data is out there, it goes so many directions so that the value of your PHI or your healthcare record is not $2 or $3 like your credit card. It's like $500. So that's the reason cyber criminals continue to really infiltrate healthcare. It's just the value of our information. All right, I'm going to wrap up here in just a couple of slides and say, we've done 450 of these cyber assessments, and we've collated all of the data. And this is what the overall snapshot looks like, is there's tremendous room for improvement. You can see it on the left side of the screen, percentages and then there's a red line at 50%. That's really the cutoff where that's the 50% of hospitals would receive a passing score based on cyber professionals' expert opinion. So you can see across Health and Human Services, 10 essential goals, only in really 3, maybe 4 areas do more than 50% of rural hospitals get a passing score, right? So there's tremendous opportunity to keep working on our cyber hygiene, our cyber resiliency. And I've highlighted here, we talked on the previous slide about known exploited vulnerabilities. These are areas where we can continue to struggle from a rural healthcare perspective. It's things like, well, we know we've got a problem over here. We've got kind of a network or a server that could be risky because it's got old technology on it, but we just haven't gotten to it. That's that known vulnerability. There's still organizations that haven't done a lot of work with encryption, and that leaves them vulnerable. And across the board in healthcare, the number one risk area are your vendors and their touch points and your vendor supplier cybersecurity. Because once a cyber criminal has infiltrated a vendor or supplier system connected to your systems, you are by definition at risk, if not infected. All right. Just one other quick thing. I mentioned Starlink earlier. Part of what I did when I joined Microsoft and really helped launch and lead is I got together with some other very passionate health IT professionals, and we started a nonprofit called the Rural Health Community. And again, it's just sort of an organic grassroots effort. It's free. We don't have any sponsored, well, we don't, Microsoft helps fund it a little bit, but it's really out there for rural health IT leaders to have a place to network and to bring their voice to bear. And so when we started the program a year and a half ago, we surveyed 200 folks and said, what do you need most? And they said, more people, more money. And we said, of course. And then they said, we need satellite service. We're like dead in the water with some of these other initiatives until we have stable, reliable broadband and bandwidth. And so we went out and we literally asked SpaceX, would you help us? Would you help support rural healthcare? And to their credit, they said yes. And they created a collaboration with the rural health community. Rural health providers, hospitals, clinics, FQHCs, et cetera, can get Starlink units for 80% off of commercial price. So if you're interested, again, I'm going to send these slides out. You can scan that. You can go and there's a place to log in and get more information. This is not a Microsoft thing, but it's so fundamental and it's such a need across healthcare. I always like to talk about it. The other thing we did in conjunction, Microsoft and worked with the rural health community team, and we actually worked with a CA in Oregon on this. This CA came to us and said, we're really just struggling with AI governance and getting ready. We don't even know where to start. So we worked and we created a set of policies and tools really geared for rural healthcare organizations and hospitals around a charter around the use of AI, guiding principles, just basic AI policies. And we have created a application tracker, kind of a use case tracker that we're testing right now. And then we put it all out on our website, and it's on the Rural Health Community website for free. So if you are in the process of creating your governance around AI, your policies, feel free to go and log in and download these tools. I think we actually left them in Word, so they were easily modifiable, and you could take parts and pieces. Really, the goal is just to help rural healthcare organizations jumpstart some of their planning and work on this. All right, last slide here. This is Melvin Kranzberg. And I will send a Starbucks gift certificate if anybody who knows who Melvin Kranzberg is. This is like 1950s. Cracks me up. He was a technology historian in the 1950s. And he is famously credited with coining the term, necessity is the mother of all invention. He also has another really powerful line, which is, technology is neither good nor bad, nor is it neutral. And I leave that with you because, we have to be always thinking about how we can use sort of tech for good and how we use technology to address cyber criminals, or we use technology to advance human and to augment human thought, and really how we use technology to support patient care. So, Jill, thank you to you and your team for this opportunity, and I can hang out here to answer a few more questions and make sure we send my email out in case people want to follow up after this.
Thank you, Laura. Do we have any questions? And I'm not sure you can go off mute or not. And you can always put it in the chat.
All right.
Hearing none, no hand raises, no chats. Estefania is going to send out the presentation to you all. And thank you very much for joining us today, and have a wonderful weekend.
Take care, everyone. Thank you.
Thank you, everyone.